So lung cancer is a very important cancer to discuss today on the occasion of World Lung Cancer Day. So basically we need to understand what increases the risk of lung cancer. So mainly people consume tobacco in any form. It can be consumption of cigarette, bidi, pan, supari with tobacco content. Any form of consumption of tobacco will increase the risk of getting lung cancer. Now there are some other causes also which can increase the risk of lung cancer, such as passive smoking. Like if a person is not addicted to tobacco or smoking, but if his peer groups, if his friend circle is having addiction to smoking tobacco, then that person will be exposed to secondary smoking, and that also will increase the risk of getting lung cancer. Another important cause of getting lung cancer is pollution. So these days pollution has gone up to an extremely high level, and the pollution contains basically several hydrocarbons which are also considered to be carcinogen. Exposure to the pollution also in one way increases the risk of getting lung cancer. Now coming to the methodology or how to reduce the risk of lung cancer. So the most important thing which one person can do to reduce the risk of lung cancer is to quit use of tobacco in any form. So we have to make best effort to make sure that the addiction to tobacco is reduced, the consumption of tobacco is reduced in the form of reducing the number of cigarettes smoked per day or the amount of tobacco consumed. Stopping tobacco is not that easy job. So basically what we have to make sure is it should be incrementally reduced. So any person who smokes 10 cigarettes per day will not be able to quit smoking cigarette the very next day. So there is something called tobacco cessation program which are available in medical centers. An attempt is made to gradually reduce the consumption of tobacco, and the final goal is to completely stop the consumption of tobacco. So this is one very important thing which we can do to reduce the risk of lung cancer. Another thing which we can do is to avoid the peer groups who have addiction to tobacco and who smoke frequently, in order to reduce the risk of passive smoking and thereby reducing the risk of lung cancer. Third thing what we can do is, as a government policy, actually attempt should be made to reduce the pollution levels. So by reducing the pollution levels in a city or a town will definitely reduce the risk of exposure to carcinogens and thereby will reduce the risk of acquiring lung cancer.